Welcome to the Luke Coutinho Show, where we can learn to reimagine our lifestyle.
Hi, Shalini. It's a pleasure to have you on my show today, which is called Reimagine Your Lifestyle. The vision of our show is very simple. We speak to people around the world who have the ability to empower ourselves and our audience to just reimagine their lifestyle. Because I have this strong belief that we can't build on a broken system. Sometimes we need to, change the entire foundation and start to build again. And that's why we call this Reimagine Your Lifestyle, where we look at our lifestyle and we'll say, okay, these are a couple of things we need to change when it comes to your health, when it comes to your exercise, your emotional wellness, your sleep. And I've been waiting to get you on the show for the longest time because I remember a couple of years ago coming down to Tata Memorial Hospital to meet you. And I remember you picked me up from the entrance, and that difficult walk for me, down the passageways with young kids with cancer. Some of them just finished their treatments, right up to your office. And I asked you, do you do this every day? You said, I've been doing it for back then 15 years, and now I believe it's 17 years. Every day, this is your walk to your office. You've inspired me in many ways, to look at service in a different way and to figure out that there's more than just donations of money, while that can be important and supportive, but service, time, volunteering, blood platelet donation. So I'm really happy to have you on the show, Shalini. And today, I would love for you to start off by taking us through your journey. It's not easy to be in that hospital setting for 17 years, seeing small children with cancer, babies with cancer, and seeing them die sometimes, seeing some of them survive and live beautiful lives, as well as adults from all across the country. So I would love for you to start off with your journey from, what got you into service? Was this always your dream to get into service? Over to you.
Thank you, Luke, and it's such a pleasure to be sitting here today and talking to you. And believe you me, I've been reading about you, knowing about your work since so many years, and it's a complete pleasure for me to know somebody like you. Talking about my journey, in fact, I'd like to mention here that my first exposure to social service happened many years back when I was in school in grade 6. I had taken up social service as my sixth subject, and we were taken to the creche right behind the convent school to volunteer. And I had spent a couple of hours there just, taking care of small babies while their mothers had gone to work. And the joy that I got that time was of a different kind. And I think that exposure is what set the foundation to me understanding service, and then to take it on, bit by bit through my school and college years. I started volunteering at Cheshire Home, I think when I was in grade 8. And every time I went somewhere to volunteer, I would try and ask the supervisors that which is the most challenging area to be. And I would try and be there, with the patients who really needed help the most. And so that was about school. And then slowly, that kind of I started choosing that as a way of life, and that's when I decided that I want to continuously do this, and that's very early when I, kind of dedicated my life to service. I also realized that when you do service for others, there is a joy and a happiness that you feel, which is boundless. It's very unique. And that joy is not dependent on getting something from someone else. So a lot of people think that happiness is probably a trade. When you do something for somebody, somebody else needs to do something back for you in order for you to feel happy. But out here, over the last 23 years of my journey with social service, there has been this unique happiness which has always stayed, and that's my reason to be here. One thing led to another. I got married early. I had my children very early, and after that, I started volunteering in a few NGOs. I also worked out of Breach Candy Hospital for 5 years, where I learned social service in great detail. And then in 2007, I joined Tata Memorial Centre. And even when I walked into the gates of Tata Memorial way back in 2007, I decided to work with children with cancer. And in 2010, the then head, Dr. Banavli, spoke about how pediatric cancers are different from adult cancers. Pediatric cancers are curative cancers, and the children who get cured of pediatric cancers, they can live healthy, productive lives for 60, 70, 80 years and be normal individuals, give back to society. So we should treat them differently, and that's when we set up the Pediatric Foundation. The ImPaCCT Foundation was set up in 2010. And what we did is that we first reached out to almost the children for 3 years to find out, the abandonment rates of pediatric cancers was very high that time. It was almost 25%, which means 25% of the children would come to the hospital and not take treatment and die eventually. So we reached out to their parents. I conducted almost 300 interviews with parents whose children had passed away over a period of 1 year. And the ImPaCCT Foundation was set up on the learnings of that interview which we conducted. Everything that the parents found a challenge about, we tried to put it together for them through ImPaCCT Foundation. So now over the years, we've made it very holistic. It's a beautiful model where every child who comes to Tata Memorial Centre for cancer treatment is given complete holistic support, starting with funds for treatment, a place to stay, food to eat, not just for the child but for the family, travel expenses, education for the child while the child is taking treatment, blood and platelet support, enhanced counseling, infection prevention support, and lastly bereavement support for the few children who lose their lives while on treatment. So it's very holistic, the ImPaCCT Foundation. And the impact of ImPaCCT Foundation is that the abandonment rates, which was almost 25% way back in 2008, it has come down to a 2% now. It's over amazing. The last few years. So which means we are being able to save so many more lives.
Just to go back, Shalini, that's amazing. Why was the abandonment rate at 25%? When you did your interviews, what were you finding out? Why were people abandoning or not even starting the treatment?
So there were several reasons. The top 3-4 reasons during the survey we found out was the financial constraints, which was the direct costs for treatment and also the indirect costs for treatment, which is like your travel and your stay and so on. Another huge reason for abandoning was the lack of belief in the curability of cancer. So which was arising from the stigma around cancer, and all of this was stemming out of illiteracy. So people did not want to come and take cancer treatment. People were also resorting to complementary and alternative therapy at that time. So things like this exist even today in India to a huge extent, where people coming from rural India would want to do other forms of treatment which they think is a form of treatment, like jhad phook, jadoo tona, thinking that it's a gift given by God and that they should not treat their child, they should let the child be. And another very alarming cause was the gender bias, which is again prevalent in our society until today. So we used to see that the girl child who are inflicted with cancer, particularly where the treatment would leave a permanent disability, like bone cancers or eye cancers, the girl child's parents would not want to take treatment. And those cases were generally abandoned. So these were the top 3 reasons for abandonment in our country.
So through the ImPaCCT Foundation, you all conducted training programs and of course the support for finance and treatment and everything else.
Yes.
Shalini, I've never seen you unhappy. I mean, I know we're humans and you must be going through that, but whenever I've ever met you, whether it's at Tata Memorial, outside of Tata Memorial, during blood platelets, You know, you've always had this happiness. Does this happiness come from the fact that you're involved in service, like you said, that boundless joy that you speak about? Do you think it comes from that? Or is there a part of you that's just learned to live with the system? We all get used to our environment and our workplace and the kind of things that we do.
Generally, people say that, you have to follow some religious path, or you have to follow some guru, you have to meditate, you have to read good books, you have to, you know, do soul searching, and you have to see what is your purpose of life. And I've been very blessed and I've been very fortunate that I think that hospital and the service that I do, it is such a complete package that it gives me everything that I should need to live my life. And when people come into Tata every single day of my journey, I come across patients who have been diagnosed with cancer. And many of them are curative, but a few of them are not curative. And then they are given this news that they probably have just a few years or just a few months. And then, suddenly all hell breaks loose, and then they feel that, there are regrets, and, they feel that we should have done this, or with this limited time, we would have wanted to do this. And then, they probably are reaching up to their God and asking that, why is it me and why am I punished for this? And there's so many things that, we hear patients speak when we counsel them. And I have believed that what if each one of us realizes that our life is short, it's definite, and that why wait for something to happen to us to have these life lessons or to learn something about life? Why not always think that today is the last day and we need to make it our best, and to be happy with what we have and to be content? Yes, we should strive for the best, we should all be ambitious, but we should also find our peace on a daily basis. That should never be conditional. And I think these lessons over the years has helped me be the way I am.
No, I think that's beautiful, and I absolutely kind of resonate with everything you say, because today we're studying longevity. Now, you may think, like, the work I do, you may think, why am I studying longevity? Because anything that goes towards longevity is increasing your health span. So they're not two separate things. So if someone says, I want to live longer, they could have cancer or they could not have cancer, but they come with a goal of wanting to live longer. So what do? You improve their health span, because your health is dependent on how long you live.
Right.
But for the longest time, the last couple of years, you'll see a lot of information about longevity, supplements being pushed for longevity, certain breathing techniques and stuff. But the research that is unfolding comes directly back to the point that you talk about. It's called positive psychology. I'm not talking about toxic positivity. I'm happy, and everyone's like kind of getting so toxic positive that they're not learning to face real emotions.
Right.
What positive psychology means is, number one, these are the measures. How
Right.
good do I feel about myself, irrespective of what's happening?
Right.
I could be going through a disease, I could be going through a breakup, I could be going through family issues. I can feel those emotions, but at the end of the day, do I feel good about myself? That's number one.
Right.
Number two, how much time do I spend in the parasympathetic nervous system, which is rest, not stress.
Right.
I could be having all the organic food and supplements, but if I'm always stressed, there is zero scientific connection to longevity.
True.
The third is service to others, and this stands out at the top. How can I help? Why? Either through social, like you're doing, or even just help my neighbor, help a friend, help a stranger, because I love the word you use, boundless joy. That's what you get out of that.
Right.
And so we've been looking at this research, and then this whole Blue Zone Netflix documentary came, and Dan, he's going to be on our next podcast, in fact, which is amazing.
Okay.
He went to all these blue zones, tried to pick up certain foods, tried to pick up certain commonalities. There were a few. But at the end, in a nutshell, it was human connection, service, looking after one another. And that was happiness that kept people the longest living. And when his documentary showed people who were 105, 103, 102, and when I look at our study of, we have people who are 102 now, 90, 108, 104, 103, None of them have these size 0 figures or six packs or are on supplements or all. The commonality was they just learned to make the best out of life. And their purpose at that particular age or before is to look out for my fellow human beings.
Yeah.
So you can have service in a hospital, outside of a hospital, and that's why it resonates so much that you are on that path right now. And
Right.
today, sitting here, with my experience of nutrition and integrative medicine, before when I started off 13 years ago, nutrition was at the top. Obviously, it's my subject. I'm going to say it's the most important today. It's right down today. It's important, but it's
Right.
down. And at the top is how do we get people to feel good about themselves? And for that, when people ask us, patients want to change, service. We tell them, no matter what it is, get into service, because that joy that you spoke about, boundless, nothing can ever give it to you. I found that in my career too, because we are in not like your service, but sometimes we have our programs where we're treating people free or we're going into situations where there is no expectation. And like you said, that boundless joy that you feel, there is nothing in the world that can give it to you.
Yes.
So I think that's so beautiful what you shared, Shalini. And like I said, I've always seen you radiant and, I just love the work that you do.
Thank you.
But now I know, and I am going to pick your brains for life lessons along the way. Just the life lessons that you've learned, and also from, I know you speak to people who may be dying in the next few months, parents. I have my own lessons from people who are dying on our programs and stuff because they're terminal, end of life. I would love for you to share with us some of these top life lessons that has evolved you, shaped you, and that you would love us to know about. Because you're in the system, we're all outside there doing different jobs, and we would love to benefit from some of your life lessons and some of the lessons that you learn from patients who may not live in the next couple of months and eventually die while on your watch as well.
Right. So, Luke, I have a lot of people who come to me looking for ways and means to do service. School students, college students, housewives, people who've retired. We have so many people walking into Tata, making calls to us that can we come and help in some way. Yes, one aspect of help is the monetary donations that come in, because our whole institute, it runs, with the help of subsidies
yeah.
and the government grants, and then the donations that come in. But equally important is volunteering. And I always tell people who come, and anyone who comes to Tata, I always sit with them, have a chat with them. Sometimes we get groups together. And what we tell them is that don't just think of coming to the hospital and volunteering. First, whenever even this thought comes into your mind that you want to do some service, reflect back and see what is it that actually touches your heart. Is it that you want to sit with a child and you want to educate a child? Is it that you want to go to the slums and you want to do something on hygiene? Is it something, do you want to go to an old age home and be with the elderly people? See, reflect that what is it that is actually touching your heart. Take out time and then find out that something that is matching to what you want to do, where is that available? It could be an NGO, it could be a government organization, it could be a hospital. It could be a program online where you're teaching somebody. So don't rush. And I always tell this more to the parents, especially when it comes to college admissions and, when they want to do community service hours in school, they're a little rushed. And I always tell them that, no, let this be a journey for your child. Enjoy it and then come to us. And then whenever you figured what is it that you want to do, and eventually if you all want to do something with cancer, then absolutely, we'd love to have you. Even when they come to the hospital, we people are a whole community in the hospital. So we function not just with us staff, but with our volunteers, with the parents of the patients and the family members of patients who are already taking treatment. In fact, they help us while their children are on treatment. And then we have our own childhood cancer survivors who are actually the best teachers for the new children who come in. So it's a whole ecosystem there, and we can't do without all these people. So the lesson we learn is that the more the better, and we, with the cancer, numbers just going up, we need more and more hands, and we want people to come and join hands with us. So this is about volunteering. And also another area which is very close to my heart, Luke, is that I do bereavement counseling. And in the hospital, we just like in the West, you have chaplain services in the hospitals. We don't have that in our hospital, and generally it's the doctors or the social workers who are with the families. And particularly, we know in the ICU which children are not doing well, and they are nearing the end. So I get to spend a lot of time with such children and young adults, and also with their parents. So we have to slowly start preparing them, for their for the beginning of the end. And I also I spend a lot of time talking to such children. And another lesson that I have learned, and something that I believe in, is that when children or young adults, or even adults for that matter, when they are walking towards their end, they actually transcend, and they get a lot of spirit and courage which is coming from God or some universal, there's some supreme power. And we see their thought processes transition. All that fear which is there initially, and it kind of slowly goes away. And there's a new strength that comes up. And we've had several of our children towards the last few days inspiring their parents that how should they be living their lives after the children are gone away, or what should they do, or how can they help out with cancer, or how can they help the hospital. We've had so many parents who formed NGOs in the memory of their children, who are part of our community in the hospital, and who are serving thousands of children, in around. So these are beautiful life lessons also that I've learned along the way.
Yeah, I like the one about children, because we've seen that as well. I remember this case of this young girl dying in her mother's arms, and the conversations that she had before that with the mother. It was like it was not her. It was like there was some supreme force, which I believe is God talking through her, which I think, Mom, don't worry about anything. I'll see you soon. I'm going to be with you. Dad is with you. And a few hours later, she died in her mother's arms. And I remember a 13-year-old boy, brain cancer. And the mother, the whole family was like literally how they would be when you get to know it's like a glioblastoma. And very, very few weeks left to live because there was organ failure. But this boy, I remember the strength, and I'm like, where is this coming from? Like, you can't fake this kind of a strength, which gave me strength and everyone in our team strength when we saw this demonstration of, so I like what you say about they get this energy. But then why is it so different for adults? Is it because we've, kind of lived so much more, we have our layers and more fears and, more thoughts? Because we still see so many adults resist death, in their deathbed and their families. And I think that makes the process a little more harder for them to, accept the end of life. Do you see that as well happening?
Yeah, for adults, it actually, what happens is that there are several phases. For children, it's relatively more simple because they don't know what they are facing. But for adults, because obviously they're knowing exactly what is happening, it starts with, the news being broken to them. It takes them a while to absorb the news. It takes a lot of time for the family to absorb the news. But even then, we are constantly counseling such patients that acceptance is the most important thing. And then to think about what they want to do with, the journey that they have left. So to take their treatment, but at the same time to take care of their minds, to take care of themselves spiritually. These things all go hand in hand. So it's very important for the whole family in such times to come together and to take care of the patient. And sometimes it's more hard for the caregivers than what it is for the patients. So we always sit and counsel actually the whole family together, because all of them are in this together, and they need to cope with it together.
Right. Shalini, now you've seen so many kinds of cancers happening from across our country, which is very diverse, from head and neck to brain to, pediatric cases. So when you sometimes reflect and you look at the rising cases of cancer coming up, keeping science aside, keeping what the newspapers say and the media, according to what you've seen and you've been absorbing and reflecting, why do you think this is happening based on your thought process of what's changing in life, what's changing around that cases are going up? It's great that treatment can be curative now at a very different level in pediatrics and stuff, and even adult cancers. There are so many more treatments, there are so many more new technologies coming out, which are great. But the fact is, there are so many more cancers coming in across all ages. So, I wanted your perspective on that, just your thoughts based on the feelings of, your gut instinct.
So, Luke, something that I share with my children, they are both adults, and something that I share with my family is that in this whole race of life, we've somewhere forgotten how to be simple. And we, wake up and we're in a race. We're just racing for something or the other in life. Yeah. Yes, it's great to be ambitious and it's good to race, but we have to learn to divide our life into verticals. And the way I tell myself and my kids is that if today you have to imagine that my life is 5 verticals, I would say that my most important vertical is me. And it's about my physical self, my spiritual self, my mental self, my emotional self. So everything to do with me. Then there is one aspect of my life which is my work. So my hospital, which is actually my way of living. The hospital is my way of living. And then there is my immediate family. So that's another vertical for me, my nearest family members. Then there is my extended family. And then there are my friends, people who, I'm close to. So we have to take out time and understand what is our life purpose. We have to take out time and see that where is it that we should spend time, what is it that we should do. And all of this, if we allocate time properly and we are intelligent about our day, about our months, about our year, about our total time, I think we'll able to understand the purpose of life better and we'll kind of slow down. People are always running around, people are stressed, then they're not able to cope up with their own timelines which they have set. Then there's this competition, and then in order to manage all of that, they start taking things that they're not supposed to take. They're bending so much towards tobacco. Then they're not taking care of their health. There is no exercise. People they're just running. So I think the only thing that I would like to share here is that slow down a little bit. Just take out little time and understand yourself. Understand your connection with the universe first, and understand where is it that you need to slow down. What is it that works for you? And the most important lesson is just be happy, because that is so important. If you are happy, you will be able to spread happiness, and people around you are going to be happy. So just be happy first.
Shalini, that's beautiful, slow down. And, we could talk about the complications of cancer. We can make it sound complicated, which it is today. That's why, there's medicine which is constantly transforming. We can talk about nutrition, exercise, all of these things, the environment, the pollution. But deep down in my heart, I completely share the same thoughts as you when it comes to slowing down. Because I believe our own spiritual selves are designed to actually look after us. But when there's disharmony, like you constantly said, stress, resentment, all of these issues happening in us, our own intelligence, which is meant to prevent or even help us when we fall sick, we don't engage that. While we will take medical treatment, and we should, while we will change our nutrition and exercise, I feel that's scratching the surface. But if the foundation of how we feel, the foundation of I look at science through the sympathetic and parasympathetic. We're supposed to be in sympathetic for a very short period of time. The human body is very resilient with that. And we're supposed to be more in parasympathetic. Even if right now we're in Mumbai and there's pollution around. But the more time I'm in the parasympathetic, what am I doing? I'm regenerating. I'm repairing what the pollution is destroying. But if I have this pollution outside and I'm in sympathetic, I'm not in repair, I'm in inflammation.
Right.
You know, it just gets worse and worse. And that whole piece of advice of yours on slowing down has to be on every medical prescription. It needs to be on every medical prescription. These are 6 cycles of chemo, 30 cycles of radiation, or whatever. Here's your diabetic drug, here's your pill for your headache, but you also need to slow down.
Yeah.
Because then you're engaging your body. We know the body heals, but we also know today with how diseases, you will need certain medications and treatments. But most people have not even harnessed the healing ability of their own immune systems because they're in the wrong system. Healing is in parasympathetic. Healing cannot happen in sympathetic.
Right.
And look at it. Look around us. Everyone, mostly everyone, is stressed out and moving so fast. And then it is the valid point, but this is life. So I always tell patients that yes, this is life, but if you're this busy, all the more reason for you to slow down and make times for relaxation, reevaluate. I love how you explain the verticals, you know, prioritizing those verticals. And I did see, I like the order as well. You know, friends, it doesn't mean you don't respect your friends and love them, but they have a place in our life based on our priority.
Right.
And I think you're so clear about how you've put everything into a vertical. I think that's a great takeaway for me from you as well on this whole topic that we're talking about today. So coming back to slowing down, I would like to ask you how you manage your stress levels. And was this difficult for you moving into a lifetime of service? Did you face any challenges, you know, family, friends, society, your own internal pressures? Did you face that journey while moving into these now 23 years of service?
So yes, absolutely. In fact, Luke, I come from a very conservative background, and I actually got married when I was 18, and I had just finished my first year college, and then I had to travel abroad. I was there for a couple of years, and I remember that when I came back to Mumbai, and then I joined Breach Candy Hospital, the only qualification I had was first year of college and volunteering in several NGOs for a couple of years. But I got a lot of support from the hospital. But at the same time, I realized that our society that way is very adaptive. There is space. You just to be, at least to do service, you don't have to have any experience. You don't have to have any qualifications. If you are empathetic and if you are compassionate, you will find your ways and means of going and connecting with people and doing service. And that's exactly what I did when I started in Breach Candy. I started putting together all the information. I started putting together all the lists of NGOs, and then I started, counseling families, meeting them, putting their paperwork in order, and that's what I did in Breach Candy for 5 years. When I came to Tata, the role was far more challenging because I started off as the secretary for the ImPaCCT Foundation, and now I'm the officer in charge. So there's a huge responsibility that I have taken upon me. The ImPaCCT Foundation is taking care of almost 4,500 newly diagnosed cases of childhood cancer in our country. And I'm taking care of 9 hospitals across the 6 states of India. So that's the number of hospitals we have. And the responsibility is that no parent should ever feel that their child did not get a chance of cure because they were coming from the poor socioeconomic strata. And that is the only single mission and vision that we all at ImPaCCT Foundation have, that there has to be an equal chance of cure irrespective of your caste, your gender, your creed, your socioeconomic status, and the finances that you have, the insurance that you have. And yes, the foundation has grown. In fact, the model that the ImPaCCT Foundation has made, it is economical, it is durable, tried and tested, and it's not just in all the Tata Memorial Centre hospitals, but it's also being replicated across all the hospitals of the country slowly now. And also it's being used by hospitals in similar settings globally. So it's working very well for us. And there was something very beautiful that one of my one of the people who I believe in shared with me, Dr. Mohan Bhagwat. What he said to me a couple of years back was, when we spoke about Impact Foundation, he said that he asked me about the work that Impact does, and I shared. And then what he said is that this is actually not the complete circle. And I asked him, I said, what is your meaning of the complete circle? And he said that when a child who gets cured of childhood cancer gets educated, becomes a productive and a healthy member of society, and then picks up, a good career path, and then comes back to the hospital and does some service for some more children at the hospital, then that is the day you should feel that the circle is complete. And today I'm proud to share, Luke, that there are so many of our childhood cancer survivors who are coming to the hospital regularly, and they're helping our children on a pro bono basis.
It's amazing.
And so many professionals working with us. So we are so happy about this whole thing, that yes, we have a complete circle within us in this.
Wow. I think those are the seeds that you'll have planted right at the beginning of this whole Impact Foundation.
Yeah.
So Shalini, what are your mechanisms when you feel stressed out, when you feel down, when you feel unhappy, when you go through your own emotions? What are your mechanisms to help you feel better?
Luke, I begin my day with a walk in the morning. I go to the gym or I go for a walk, and I start with always putting my day in perspective, and kind of going through what my day is going to look like when I walk in the mornings. I never go to bed without auditing my day in my head, that where is it that I have gone wrong and what is it that I should have done better. We have sometimes in the hospital, we have some bad days when the children who we know very well have passed away, or when we are counseling a child who has become palliative, or a young adult who has become palliative. They're the hardest actually to counsel. So I do have my low moments. There is once in a while that I'll just close my room and I'll feel a little sad within. But then we also believe that this is a cycle of life, and these things have to happen. We have to accept it very gracefully, and this is how human life is designed to be made. And what we can best do is that help the family with grief counseling, and help them and give them the confidence that they did the best that they could for their child, so that when they leave our hospital, they are also in peace. And we also ensure that, so these are the few steps that we do. But yes, I also constantly keep going away for short holidays. I love the mountains a lot, Luke. So every 4 to 5 months, I take off alone to some mountain where I go and spend time. I meditate, I connect with nature and with the universe, and I try and think about my own life purpose, and that gives me a lot of strength.
So that's your recharge.
That's my recharge. And I journal sometimes. I write a few lines, and sometimes a little bit of poetry. So.
Oh, that's beautiful. I like what you spoke about, the acceptance part, because this morning I was having a conversation with Sister Shivani, and we were talking about stress when it's out of our control, like death or someone's palliative. There's nothing much you can do right now. And we spoke about this brilliant point of, first there has to be acceptance that this is it, because in a state of resistance, there's only going to be more suffering.
Yes.
So now acceptance, and what's the next best thing that I can do? So help the grieving family.
Yes.
I think that's beautiful, and I think that's what most people with stress today have to use. It's actually a very simple formula, but because we want to control and be in control of everything that cannot be controlled, I believe that's what gets humans the biggest stress. Because we do this simple exercise all the time with people, Shalini, when they say we're stressed out, we have this, even if they have cancer or not. But the point is, we break it down. What is in your control? What is out of your control? What you can do, which is in your control, give your 500%, give your 1,000%. But what is out of your control right now, not tomorrow, not in the next hour, you need to accept. And only when you're in that space of acceptance can you actually now move on. Otherwise, there's denial and there's constant fighting. And I want to go back to a point which really resonated with me, Shalini, when you spoke about, spirituality. Some people meditate, some people do all of these things, but you you find your peace in service. And I think that's beautiful as well, because when I look at, and I love studying every religion, because I believe every religion is built on common foundations,
Yes.
and that common foundation in religions and spiritual paths comes down to service.
Yeah.
And that is, I meet a lot of people who say we don't meditate because what we do makes us genuinely happy. And I don't believe it's necessary that everyone has to, because people who are in service, their energy is at a different level, their vibrations are at a different level.
Yeah.
And maybe meditation is a great tool for people who need to come up to there. But I feel sometimes, people say that we can't meditate, we find it difficult to meditate. Your option is put yourself into service.
Yes.
You don't have to meditate, because in service, everything kind of changes. So, no, that's amazing what you shared. Shalini, this has been amazing. And, how can we help? I'm aware, I would love for you to speak to the audience. We know what ImPaCCT Foundation is all about, what they need. But I would love for you today to use this platform to speak about what do you all need at this particular point for the amazing work that you and the doctors, I've had the privilege to spend time with some of the doctors, and I know how busy they are, but yet they're able to be so humble and grounded and speak to you. They speak to our patients so patiently, so beautifully. Something's working right in that whole system that you all have built. What is it that we can do to help? What is it that all of us today watching can say, hey, there's one thing that I would like to start doing? I would love for you to speak about that.
So there is something that I would request everyone to work towards, is that I always feel that service first begins at home. So you first take care of your own homes, which means you also take care of the people working around for you, your staff. And generally when people come in with cancer to the hospital, we see that we are not able to put a lot of them onto the right government grants because their documents are not complete. They don't have their paperwork in order. So it's a request to everyone that help all the people working for you to have their documents in order. Beautiful. Because that actually takes care of half the problems, whether you're taking your staff to a government hospital, to a BMC hospital, to any other place for medical help. Help them and then understand the journey that they are going through, because if your loved ones are going through some sort of sickness, you are there for them, but you should also be there for the people who are taking care of you. So if they are away from work and if they cannot attend to their responsibilities, be a little easy on them, because I see that that's their biggest panic areas. And that's for the people. And then for the institution, if you want to do social service, first try and see that even in the hospital, which is the area that you would like to get connected to, whether you want to work for children, whether you want to work for women's cancers, whether you want to work for adult cancers, choose your area of support. And yes, the biggest way to raise funds is, to get everyone to get treatment is to give donations, but material donations, volunteering your time, connecting us to the right people, helping in little areas, helping during the festival times and spreading happiness in the hospital. There's so many avenues available, so whichever works for whoever.
That's amazing. I'm going to post this in the podcast notes so people can work out. Yeah. And even if you have a number or an email address where people can, because we'll have a lot of audience and they were part of the last fund that we did with you all.
Yes,
and absolutely. A lot of people from around the world, they're eager because they're not living in the country, but there are such amazing people around the world who they feel for causes like this and they want ways to, easily be able to help. So we would love those contact details so that we can put it in the show and people can reach out if required. So Shalini, before we end this, what's your advice? You've given us a lot of rich, gems today. But what's your advice today? I know I've met your daughter, one of your daughters. I think I've met.
Yeah, you met Devanshi.
Devanshi, right? Yeah. I've met her, and I'm sure you shared all of your life lessons with her. But today, what's the message you would leave our audience with? So, for example, if you had the entire world listening to you right now, what message would you leave for everyone?
That wake up every morning and feel blessed that you have today. Be in the moment, be happy. And if it means to reach out to somebody to clear something, to resolve something, to forgive somebody, go and do that, because today is all you have and today is really precious.
Thank you, Shalini. This has been so, so amazing.
Thank you.
As always, it's a pleasure. I've waited for the
No.
longest time for this to happen, and I have an amazing team, so they make it happen at some point
Yes.
or the other. But you've been just doing fabulous, fabulous work. And one of the main reasons that I've been drawn back to Tata Memorial all the time, I would be lying to say it's just the patients and the people that I see, but it's your energy. I've been inspired from the time I've met you right up till now to continue supporting in whatever way we can, you, your patients,
Thank
and
you.
everything else that you're doing. So
Thank
thank
you,
you very much, Shalini.
Stay tuned for more. We're going to continue our journey, learning, sharing, and evolving.